endometriosis. The Australian Institute of Health and Welfare study also found the number of young women needing hospital treatment for the condition has doubled in a decade. For more, I'm joined by Endometriosis Australia CEO Marie Davenport. Marie, thanks for joining us on Midday. For those who don't know, can you explain what endo is?
Endometriosis is a disease which affects women and those assigned female at birth from the time they start to menstruate, or sometimes as young as 8. It is a lifelong disease with no cure. It remains after hysterectomy and also after menopause. It's when the tissue similar to the lining of the uterus grows outside of there, most commonly in the pelvic area, but it can grow elsewhere. So it impacts organs like your ovaries, bowel, bladder, and really does cause incredible pain, brain fog, and all sorts of other ailments, which make it really difficult to live with.
The rise in the number of people suffering or living with this condition, is that due to greater awareness or symptoms, or the medical profession being more receptive to making a diagnosis?
It's a little bit of everything. We've had a national action plan on endometriosis now for the past 5 years, and we've seen the delay in diagnosis reduce, but it's still on average 6.5 years, or between 6 and 8 years. And unfortunately, that also depends on where you live in Australia, how quickly you can receive that diagnosis, indeed how to access medical care. There needs to still be greater awareness and education among GPs, nurses, emergency department staff, school nurses around the symptoms. We need to have better referral options to gynecologists, but alarmingly in the public system across Australia, the delays in surgery options, and you need surgery, laparoscopic surgery, to be able to both diagnose and treat the disease. Those delays result in around 1 in 10 people with endometriosis self-funding their operations. We know that around 71% of presentations to emergency departments, and you mentioned younger people being more aware earlier, which is great, but 71% is sent home without admission to hospital or an ongoing referral. We know that 2/3 of endometriosis-related hospitalisations occur in the private system. So there's a real issue with access and equity and affordability for healthcare, particularly when those living with endometriosis have their work life disrupted. They need to take leave sometimes to manage symptoms. They need time off for operations. We also know that around 50% of those with endometriosis are challenged by fertility, and 30% of those doing IVF have endometriosis. So that all impacts their job security, their economic security, and their ability to afford the private health insurance to get the operations done in a timely way.
The cost is huge. 17% of women lose their jobs to managing their endometriosis, which is a huge percentage. Of the financial cost, 30% it will cost someone who to treat their endo, and it all begins when the treatment all begins when somebody goes to see a GP. So what happens when the GP isn't someone that takes these concerns seriously? What can people do?
So the costings you just mentioned, it's actually around $30,000 per patient per year to manage the condition, including the cost of productivity, but also pain relief and everything. GPs, nurses, and those in emergency departments and school nurses really need to be more aware of what the symptoms are first, so that they can identify what is normal, what is not, what needs and deserves greater investigation. And as I said, the diagnostic tool is through laparoscopic surgery, so it's very, very invasive and very costly. We want at Endometriosis Australia to ensure that those on the front line at the coalface seeing these girls, women and assigned female at birth individuals who are presenting with terrible pain and symptoms are taken seriously, not dismissed. that they are sent off for referrals to gynecologists. They are given referrals to MRI and ultrasounds. The federal government has funded under the NAPE some subsidies for investigation of endometriosis through sonography as well. So it's all about raising awareness, getting that diagnostic time down, and also the longer that someone remains undiagnosed, it's not just that they're suffering, their work, their entire lives are impacted. It is also risking their fertility journey, because the longer it is before they can have an operation that will identify that they have endometriosis, the less chance they have, unfortunately, of a natural conception. And for so many in their 20s and 30s, they need to have a hysterectomy as well. So we really need to do better. Access, equity, cost effectiveness, and greater investment from state and territory governments as well.
From Endometriosis Australia CEO Marie Davenport, thank you so much for joining us.